Good day everyone, Stephen Rothkieser here. So today's video covers off on 4 key points. The first is that we are inherently social beings, and I can't stress this enough, and if there's one thing that we've learned from COVID is that human beings need one another. And my wish is that if we take one thing out of this crisis, it's that we should value one another, our relationships, our families, our communities, our social systems more than ever before. And we need to protect those. That leads us to the second piece that we've learned, and that is that fear is highly disruptive in terms of our ability to engage in a healthy way with the world. But critically, fear inhibits our ability to think coherently and strategically. Fear closes down the brain and the ability for us to think creatively, innovatively. This is not a new idea. This has been documented in scientific journals and articles and research for many decades. The third thing that I'd like to speak to really strongly, which relates to the first two, is the importance of schools. There's a massive debate going on at the moment globally, and the World Health Organization has weighed in on this in the last week about schools, the role of schools, whether schools should be open or closed. So I believe categorically that it is imperative for children, particularly during a crisis like this, particularly during a very frightening event for most children, that they have some level of stability, both within the family, if they have a family, to provide such stability, but certainly within a social system such as a school. Now, I want to be very clear about this because I've spoken quite strongly, vociferously against lockdown, and that's been my strategic position on this for 4 months already. If we look at articles that were published on LinkedIn and on the Change Consulting Group website, the strategic position from a change perspective is that lockdown, a suppression approach to a pandemic is not helpful except for 2 reasons. And the one is to educate the public about the use of social distancing, washing hands, and wearing masks. I absolutely and without hesitation, not only support, but emphatically support the use of social distancing, the use of masks in all public settings, and the continuous use of hand sanitizer and preferably soap. But those 3 items are our frontline protocols to prevent the disease from spreading. Lockdown as a tool is only strategically useful. The third is a more controversial position, and I'm happy to engage with people on this, and this is a position I call diffusion. There are 3 ways in which we protect the human body and human society from viruses. The first is contracting the virus and building antibodies. And we do that as a regular occurrence in every flu season. We encounter as human beings viruses on an ongoing basis. The second is the use of vaccination. There's been a lot of hype around a vaccination. I think it's very important now, from a change perspective, for governments to start communicating that we might not find a vaccination in the short term. And then the third is perhaps controversial, perhaps untested, and perhaps untenable strategy, but I would like to put it out there, something that I've been thinking about, and that's what I call a diffusion strategy. An individual has contact or exposure to the virus in microdoses in such a way that antibodies or resistance grows within the body over time and prevents a full-scale health emergency. I don't know if that is entirely tenable, but I haven't heard enough about that being discussed in the media, and I'd be interested to know from the medical fraternity whether that is something that is a possibility in the context of COVID, particularly since it is a viable way in which we build immunity naturally as human beings from the time that we're small children against a whole host of viruses, diseases, and illnesses. We have 3 strategies then for dealing with COVID. The one is a lockdown suppression approach, which I reject, except for preparation of the health service and education of the public. And in my view, that should be a 6 to 8 week process maximum, because after that, there are too many socioeconomic, psychological, and other detrimental impacts on society. The second is a mitigation strategy, which is the use of masks, social distancing, washing of hands, which is imperative. That is our number one defense at this stage against this virus. And then the third is this idea, which I'm introducing today, of diffusion, which is a slow microdose exposure to the virus over a period of time in the course of our general lives. So what have we learned so far? We've learned that lockdown doesn't work beyond 6 to 8 weeks. We've learned that as human beings, we need each other more than ever. We've learned that, in my view, schools is absolutely imperative within the context of using strong protocols and preparing staff and students for that type of schooling environment. The fourth is we need to start thinking about a post-COVID world. And that world, in my view, does not look very different from the world we had prior to COVID. I've been very concerned about what, in my view, are fairly opportunistic approaches by various organizations to COVID, using COVID, sometimes quite cynically, to push through changes that they haven't been able to manage up to this point, closing institutions, retrenching workers, introducing technology, introducing surveillance systems. I don't support any of that. I've spoken to these issues repeatedly in articles over the last months and even years. I don't believe that it's desirable for governments to be increasingly centralized. I do not believe in models of social surveillance like we're seeing increasingly within the world, certainly since 9/11. I don't believe that this builds a relationship of trust and confidence in government. I think it builds increased bureaucracy, builds increased centralization of power. I think it undermines democracy. I think it undermines the voice of citizens. I think it increases fear and anxiety for citizens. And frankly, I believe it doesn't support building a better world. And I, as an individual and as a change consultant, as somebody who's really critically interested in political and socioeconomic systems in the world and building a safer and more conscious world, will never support a world that is more centralized, where surveillance systems become increasingly sophisticated. And I must say, unfortunately, that China, again, is a very strong test case for the world, where they have over 600 million cameras for a population of about 1 billion people. That surveillance system is incredibly sophisticated, using facial recognition, being able to manage to assess the interaction of large groups of people in real time. And in the last year, China's introduced what they call a social credit score. I believe that that's something that we need to be very careful of in the West as democratic societies. I do see this as a strong undercurrent of what's called the new normal or post-pandemic world. And I don't believe it's necessary. I don't believe it's desirable. And I'd really like to engage with people who believe it is. In the same way, I don't believe that increased technology is of particular benefit to the world. Children need one another at schools in person and not over screens. And suggestions that the future can be run over a screen, I believe it undermines the very spirit of who we are as human beings. I know that I've introduced a number of difficult topics today. I'm not afraid to do that, and I'll continue doing that. And I'd really like you to comment, like this video, subscribe to this channel, share this video with people who you think might be like-minded, but also I'd like to hear from those of you who are critical of this message. We need to start planning for a post-COVID world, and I welcome your comments on that. Thank you so much.